commonly see patients who have thyroid nodules. In fact, more than 50% of the population will have thyroid nodules diagnosed at some point in their lives. They're very, very common. But just because they're so common doesn't necessarily mean that you need to have something done for them. It starts with a thyroid ultrasound. Once we get that information from the ultrasound, it may or may not be indicated to get a biopsy done on the nodule. Now, the vast majority of the time, the biopsies are negative, and that's very good. But some patients may still have compressive symptoms from that nodule. And if they still have these symptoms where they can feel it, causing them pain, it's noticeable cosmetically, we have different options for treatment of that nodule. It used to be the only thing that we could do was to cut the nodule out, to have surgery. But nowadays we have revolutionary technology. This technology is called radiofrequency ablation, or thyroid nodule radiofrequency ablation, where we can actually insert a needle into the middle of that nodule, heat the end of the needle up using an electrode, and actually melt the nodule from the inside out without ever having to make a cut or an incision on the patient, without the patient ever having to be put under general anesthesia. We're able to do it in the office with local anesthesia and a little bit of medicine to allow the patient to relax while we do the procedure comfortably. And it has a lot of benefits compared to surgery. So number one, you don't have the risk of general anesthesia. Number two, up to 30% of patients who undergo thyroid surgery for removal of just one side of their thyroid will require lifelong medication for thyroid hormone replacement. Whereas if we just melt the nodule from the inside out or just ablate the nodule using radiofrequency ablation, essentially no patient is going to be put at risk for hypothyroidism or the need to have their thyroid hormone replaced.